Hey, today I want to talk to you about dead butt syndrome. This is a very common problem that we see. It can cause all kinds of hip pain, hip bursitis, IT band syndrome, knee pain, low back pain, and sciatica, and this upper hamstring pain. It gets involved in all those problems. So let me explain dead butt syndrome for you. First off, dead butt syndrome essentially is if this gluteus medius muscle doesn't work right. So the gluteus medius muscle is deep in your butt, and it has two main jobs. So first off, it's a hip abductor. So when it contracts, it moves the hip out to the side. But it has a second job that's super important when a person is running or walking, and that's to keep the pelvis level. So when I stand on my right leg here, my right gluteus medius has to contract. If it's not doing its job properly, then the pelvis is going to drop, and that hitch in the low back, that tilt in the pelvis, is what can aggravate all those structures. So again, right leg is carrying the weight, hip drops. We can see that's going to aggravate a bunch of different things. So that movement in the pelvis is going to aggravate these joints in the low back region. It's also going to cause some twist into this upper area of the hamstrings. And then if the gluteus medius isn't doing its job, then other muscles are going to try to do the job for it. So if this muscle doesn't do the job, then this TFL muscle and IT band try to do the job. And that, if you look at this IT band, it comes into the upper part of the kneecap, and it can tug the kneecap up and out to the side. So gluteus medius doesn't do the job, TFL and IT band try, then we end up with knee pain as well. And so there's three main ways that you can check and see if you have gluteus medius problems or dead butt syndrome. The first is you can actually push on your own pelvis. So you would come in right below the crest of the pelvis and just start pushing there. And if you get a sharp tenderness, that's your first clue that your gluteus medius is not working right. The second thing is that you can actually film yourself or have a friend film you as you walk away and watch for the pelvis to tilt. So I'm going to try my best to demonstrate right side gluteus medius or dead butt syndrome here. So basically the pelvis would drop and drop and drop. And that'd be an example. The right gluteus medius doesn't do the job. There's a hitch in the get along or a little extra wiggle in my waggle, and that's going to cause some pain and aggravation in the low back. The third thing is you can try doing some side planks. So if you try doing a side plank on each side and you find one side you can do it fine, maybe you can even add in a single leg version of this, and you try it on the other side and your body is trying to sag, that's a clue that gluteus medius is not working right. So if you find out the gluteus medius isn't working right, again, the next question to ask is, what's going on between my brain and that body part? Again, if anything's not working right, that's what we want to know as a chiropractor. So in this situation, the gluteus medius, the nerve control of the gluteus medius is this superior gluteal nerve. The superior gluteal nerve, you can see on this chart, is controlled by L4, L5, S1. So it's controlled by the nerves that come out right there. If these nerves are being affected by a problem in the spine, this spot is acting like a bonk on the forehead with swelling, and it's pushing on those nerves, it'll shut down the function of the gluteus medius. And then once that muscle's not working, then there's going to be that extra tilt in the pelvis that's going to aggravate those joints. And that's how people end up with the cycle of dysfunction, where they keep having right low back pain, they keep having hip pain, they're getting hip bursitis, they're getting IT band syndrome, they're getting knee problems, because this just keeps not working right. So I am going to take just a second here, or a minute, and show you the most effective exercise that we teach people to get that gluteus medius working better, start to decrease dead butt syndrome. So what you would do is you'd find a stair, and you'd step on the stair with the problem side on the stair, and then we're going to think about lowering the hip on the opposite side, trying to get this belt to point downward. Then you're going to hike it up, and you're going to do these slow controlled movements where you lower the left side hip and raise it back up if we had a right gluteus medius problem. So that's when I raise my left hip, it's activating my right side gluteus medius. So slow controlled motions, taking about 5 seconds to lower the hip and raise it back up. And we do 10 of those 5-second holds, 20 of those 5-second holds in a set, and do that 2 or 3 times a day. Ultimately though, if somebody is having pain in the hip, pain in the low back, pain down in the leg, further in sciatica or knee pain, we recommend a more thorough workup where we can find out exactly what's going on. So when you come in, we'd take you through ranges of motion. I'd push on each bone in the spine and I'd be feeling for stiffness. You'd get to tell me if it hurts more than it should. Then I'd be checking the function of all the major muscles in the legs, seeing how they work. Are they firing like they're supposed to, or are some of them functionally weak? And then we'd get some x-rays taken, including a motion x-ray study, where we can see if the bones in a person's low back are moving like they're supposed to, or are some of them actually stuck and not moving right. Then we're able to sit down with the person, tell them this is what we see going on and what's recommended to get the problem fixed up. And it is so exciting when people come in and they've been putting up with all these hip problems, sciatica, again, knee pain, and low back problems. And after 2, 3, 4 weeks of care, they're like, doctor, I can tell this is really helping. You know, I'm able to walk with my family. I walked around the mall with my wife for 2 hours and I didn't have that pain in my hip. So we get so excited when people get back to doing the activities they love. They're back working out, feeling great, and not putting up with that dead butt syndrome. So if you listen to this and you think that you might have some dead butt syndrome going on, or if you're putting up with any kind of low back or leg problems, click the link, fill out the form, give us a call. I'm Dr. David Crozy from Compass Chiropractic, and I'd be thrilled to get you out there doing your activities, feeling great, living the dream. So thank you.